gentleman from Phelps, what purpose do you rise?
To inquire of the right honorable gentleman from St. Louis County, the bill's sponsor.
Does a gentleman from St. Louis County, the bill sponsor, yield?
Good afternoon, gentlemen.
Or good morning. It feels like afternoon.
You're right. It does.
Good to see you.
You know, one of the things I've enjoyed about my brief time in the House here is my opportunity to occasionally work with a skilled barrister such as yourself.
Well, it's good to talk to you, gentlemen, because I believe you are currently the only medical doctor serving in the House.
Absolutely.
I believe that's the case.
Now, in the past, we've had more, and I think it's, I was concerned because many of those fine legislators were termed out, and I was a little worried we wouldn't have someone with your expertise, but lo and behold, God does provide, and here you are. So I'm glad you're inquiring of me on this bill because you probably have a lot more knowledge. I mean, I know the legalities of the bill, but you probably have a lot more understanding of the practical application of the bill.
You know, when we had the opportunity to work together and the House worked together for the late-term abortion bill last year, it was a combination of the skillful way that you, with your knowledge of the law, were able to interact with the rest of us, and I participated in that somewhat, to craft something that really was a good amalgamation of the legal and the medical. And I hope this is another opportunity for that. I believe the other side that is seeing this as an attack on women, I hope by the end of this discussion they'll see that actually this is going to be of benefit to women. And I mean that in all sincerity. I do hope there's no chuckles about that because we'll discuss a little bit how this can actually assist in the care of women who need these services, in spite of the fact that I acknowledge and we acknowledge that there are individuals that simply don't want to be involved in this. So your bill doesn't preclude these services from being provided.
Correct. Gentlemen, you hit the nail on the head. The discussion this morning, I know that folks want to have that discussion, and they're chomping at the bit to have that discussion. And even though I think that discussion is misplaced, and it really goes to a philosophical principle about what government should be mandating private companies to do, this is not the bill to have that discussion on, gentlemen. That's why they're being gavelled down, because the discussion's on a point. Gentlemen, we've heard all session long about how our side of the aisle is taking away the rights of workers and employees. Gentlemen, this bill gives workers and employees greater rights, and I hope the media prints that. This bill gives workers greater rights and greater protections. Now, because the bill has the word religious beliefs in it, I guess that's where the other side shrinks away and runs worried and scared. Maybe they don't want employees to have greater protections and rights in the area of religious beliefs, but that's what this bill is about, gentlemen, is it not?
You know, before my time expires, I want to get this point out, too, that you know, in the normal course of carrying out medical procedures, a doctor and his assistants work very closely hand in hand. And when things get a little, shall I say, involved, or it's an urgent situation, you've had a complication, or for some reason you need to move ahead expeditiously, it's very important to have somebody that's right there. When you reach your hand out for an instrument, they know what you want, they know what you need, they're following along with the case, and they provide it for you. I would contend that without this bill, if you have people whose conscience goes against the procedure that's being done, they're going to be somewhat distraught by that. And they may not be able to facilitate the procedure in as good a way as someone whose conscience didn't prevent them, who didn't bother them, if their conscience didn't bother them. So I think it's better service to women that need these procedures to have a cast of characters, so to speak, a group of medical professionals working together that are working harmoniously, and no one among them is distraught because they're being forced to work in a situation that they object to.
Gentlemen, that's an excellent point that I would agree with. When you're in the middle of a complicated life and death surgical procedure, what you just said is extremely important. You want that team of assistants around you, because it's not just the doctor doing everything. I've been in operating rooms. My father's a veterinarian. I grew up in operating rooms. I've been in operating rooms of people of your profession. There's they're crowded places, and there's a lot going on, and you want those people to be all in.
Right? There's a flow to it.
And you want them all in. You want them completely focused, completely participating, and you don't want someone going, I'm not sure I agree with what Dr. Frederick's doing right now, so I don't know. You don't want hesitation. You don't want someone saying, well, I don't know that I could do that, or pausing, or, God forbid, running out. You want people who, whatever their beliefs are, that they know that if they're going to participate in this, that's fine. If they don't want to participate in it, they let the employer know. We have a vast workforce, more and more people flooding into this type of system every day, and there's plenty of people who would participate in these procedures, but if there are folks who do not want to, because of their religious convictions, that employee's beliefs should be respected.
And also the fact that you crafted a couple of other things, the emergency section of it, that if these services are needed promptly, this bill doesn't cover them. They have to.
Correct. If you're in a rural area like where you're from, or even beyond, you're in a semi-rural area. If you get beyond where you are into the deep rural areas, and there's an emergency, then this bill has to just stand aside, and the emergency takes priority. You're correct.
One final thing, and that again, with careful crafting and working with other folks, you did manage an amendment that doesn't preclude surgeries being done in utero on a fetus. At one point, the language was somewhat vague. This simply prohibits experimentation, I believe is the term, but therapeutic treatments can go forward.
Absolutely. That's why we added that amendment about the non-therapeutic benefit, and I'm glad you pointed that out as well. There is nothing in this bill that is going to prevent any patient or person from participating in things they want to participate in. This bill is nothing more than a shield, than a greater protection for the worker to not be forced to participate in an activity in which they do not want to participate in because of their religious beliefs, which is a foundational principle upon which this country was created.
Thank you again, gentlemen.
Further discussion. Gentleman from Saline, what purpose do you rise?
Thank you, Mr. Speaker. I'd like to inquire the bill sponsor briefly.
Gentleman from St. Louis County, do you yield?
I do.
Gentlemen, just a couple of real quick questions.
Sure, gentlemen.
Let's talk about birth control. Let's say a lady goes into a hospital and requests birth control medication. And the doctor, I guess under this bill, has a right to say, due to religious beliefs, I do not prescribe that, or this hospital does not prescribe this. Is that doctor required to say, we don't prescribe it, but here's someplace else you can go and get that medication?
Gentlemen, I'm not certain about that. I don't know if there's a referral requirement or not. That specific employee, if they're an employee, do not have to participate in that.
Because I'm thinking it's okay for that physician to say, I don't believe in that procedure, so I'm not going to prescribe this. But if you want that, maybe there's another place you can go.
Well, gentlemen, I think there's a plethora of service providers out there that would provide those services. Easy to find in this day and age, in this electronic day and age, and I don't foresee this bill as providing any additional barriers.
Okay, my last question would be, if that same woman goes in and says, I'd like to get birth control medication, and the doctor says, we don't prescribe that here, is there anything that prohibits that doctor from saying, you don't want birth control, that's bad, you don't want, can the doctor weigh in on the value or the pros and the cons of birth control? Well, that has to be somewhat impartial.
That's a physician-patient privilege type of area, and if someone doesn't like the counsel they receive from a physician, they have the freedom to go to a different physician and obtain a second opinion or a second type of offer of advice.
Because, see, I can support somebody saying, I don't believe in that procedure. This hospital doesn't believe in that procedure. But I think also maybe that doctor has a right to say, but here are other places you can go and get that service.
Hey, gentlemen, there's nothing in this bill that prohibits that. This bill, again, as I said, this bill is not designed to be a sword. It is a shield only for the worker to not have to be forced to participate in something they do not want to participate in.
I understand. I just want to make sure that the patient understands that even though you can't get that service here, there are other places.
Nothing prohibiting that patient from going to another resource that has no problem with that.
Okay, thank you, gentlemen.